Hey, good afternoon. It is 3:29. My time flies when you're having fun. Dr. Sharon Richens from Richens Eye Center is in studio with me. And Dr. Richens, it's been a while. Good to see you once again.
Thank you. Thanks so much for having me.
Okay, you're going to be a familiar name to a lot of people who have had work done on their eyes, had surgery done on their eyes. But for those who are meeting you for the first time, do you mind telling us just a little bit about yourself, your background, who you are, what you do?
I don't mind at all. So my name is Sharon Richens, and I'm a physician. I'm an ophthalmologist, so I'm a surgeon and physician who treats everything to do with eyes. So.
That's an important sense.
Yeah.
I know a lot of people say, of all the things I would give up a lot, but my sight would probably be the last thing I would want to give up.
Yeah, I hear that a lot.
Very precious. And you have been, as I recall, and I've known you now for quite a few years, but you've been right on the cutting edge of a lot of very innovative things in terms of eye health. And I understand you have something to tell us about today that's right up there at the advancing edge of eye medicine.
I do. I was really privileged on Tuesday to do 4 cases with a new device for glaucoma called an iStent, which is a tiny little device. It's a beautiful piece of engineering. The whole device is literally 1 millimeter long in the long dimension, or the long arm, and 1/3 of a millimeter wide at the port. And the iStent is a beautiful device that we can use now with cataract surgery in order to control glaucoma, in order to make it easier for people who have glaucoma to keep their pressures down so that they don't lose sight. And it's great because it doesn't extend the case time or the risk of surgery very much at all. It is covered by Medicare recently. And it has the ability to reduce the patient's need for eye drops, which can save them time and money and vision. So it's really exciting stuff, and it was great fun to do.
Now, when I hear glaucoma, I think I understand what it is, but can you give us, in layman's terms, when a person is suffering from glaucoma, what's happening with their eye?
Yeah. So what is glaucoma? It's a very good question. Most people understand glaucoma to be too much pressure in the eye, and in fact it has to do with too little oxygen circulation to the optic nerve. So if you start by thinking that the optic nerve is the cable between your eyeball and your brain, so your eyeball is out there processing light into electric energy, but that electric energy has to be transmitted to the brain down the cable, which is the optic nerve. And then the brain gets to unscramble the signal for the picture that you see, right? So if the cable isn't working properly, you can have an otherwise perfect eye and an otherwise perfect brain, but no vision.
Wow.
Yeah, it would be like having a beautiful television in your living room and the cable company's still in business, but you got no signal, so you have no picture, or you've got a bad picture because your cable's not functioning properly. So when this happens to a human being, it has to do with the flow of oxygen. And high pressure in the eye is one part of it, but if the blood isn't flowing well, anywhere from the heart all the way to the optic nerve, that can also contribute to the problem. So, the traditional way to treat that is to try and reduce the pressure in the eye so that you get better circulation with less resistance, right? If you think of it like a plumbing problem, you've got the right idea. And the usual way to reduce the pressure is by using eye drops. The problem with eye drops is that they're expensive. They can make your eye itch, sting, and burn, and you have to do them every day or they don't work. And people forget. They get busy. They run out and forget to refill the prescription. Some people are forgetful. Some people have hands that don't work very well, especially as we grow older. And we would all like a solution that is inexpensive, effective, and low maintenance.
Well, even under the best circumstances, it's hard to put drops in your eye.
It's a pain in the neck.
Your natural reflexes are, don't put that in there.
Yeah, exactly. So even people who can do it and do it well don't particularly like it. And so to have this little device now that has the potential to help our patients control the disease with little or no work on their part is quite wonderful. It's not a cure in the sense that we haven't stopped the clock. We don't prevent the patient from growing older. And there may be a time that they need to go back on drops. It may be that they still have to use some drops, but not as many as they would otherwise. But it's a beautiful device and a very elegant piece of engineering, and it's been really rewarding.
So is glaucoma common in people that are over a certain age, or is it not age specific?
It is possible for a young person, even a child, to have certain kinds of glaucoma, but that's quite rare. Glaucoma is usually diagnosed sometime after a 55th or 60th birthday, and with each decade of age it becomes more and more common. So it is something that you're far more likely to have to deal with if you're over 65 or over 75. And it goes right along with high blood pressure, diabetes, heart disease, and I'm laughing because Dwight's over here putting his drops in. Yeah.
Wow.
And so I'm always joking around that as we get older, we have problems with low flow in many regards, whether it's high blood pressure or atherosclerosis, and glaucoma is kind of part of that picture.
Wow.
Yeah.
Okay, and I'm glad to hear that I have a few years before I have to really start being concerned about it. Because I'm approaching 50.
Yeah.
And just like my eye doctor told me,
yeah,
after 40, you're going to notice your eyes aren't working as good as they used to. And boy, he was right. Anything that gets about this close becomes a blur. So I'm very eye aware, where before I took it for granted, I'm always going to have eagle eyes.
Yeah.
That's not the case.
Yeah. Yeah, things change.
Are there any other innovations that you see happening in eye medicine that you'd care to mention? Actually,
there are many. With regard to glaucoma, the other one that has been a real joy to us in the last couple of months is that Merck, which is one of the big drug companies, has come out with some glaucoma eye drops that are preservative-free. So a lot of our patients who live here in the St. George desert environment have dry, itchy eyes, and the preservative in the usual drops makes them drier and itchier. And so having the preservative-free drops has been a real blessing to them because their eyes are much more comfortable, and yet we're able to control their pressure. So it's been a huge blessing. There are some other things that are changing that don't have directly to do with glaucoma. With cataract surgery, we're about to start using a beautiful instrument called the Aura, which is it's a wavefront aberrometer.
That sounds impressive. I have no idea what it is, but it sounds cool.
It's really cool. The gist of it is that you can measure a person's refraction or focusing power during cataract surgery so that you know that you've got the right lens in exactly the right place in their eye during surgery. And what this plays to is that cataract surgery is becoming more and more sophisticated and more predictable, in the sense that we get to choose the lens implant that is likely to give you the very best possible vision. And the bar keeps going up, so that a large number of our patients who have otherwise healthy eyes are seeing really well after cataract surgery with far less dependence upon their glasses.
You know, I'm thinking back, 15 years ago? Wasn't that when LASIK surgery was really all the rage? Or do I have the time frame about right?
PRK, which was the precursor to LASIK, was approved in 97.
Okay.
LASIK was approved in 98. So you are spot on at 15 years.
And in that 15 years, it sounds like major leaps forward have taken place in terms of what can be done for vision problems.
Absolutely. Yeah. And both for the young and the elderly. That's true. Yeah.
Well, and like I say, as long as I've known of Richens Eye Center, you've been right there on that cutting edge. That's to your credit.
Thanks.
For people who want to contact you or would like to learn more about you, do you have a presence online? How do they get a hold of your office?
We have a phone number, 435-652-4040. We do have a website, richenseyecenter.com. We do Facebook, and we are happy to talk to people who just happen to walk in. There are videos about many different eye topics, including glaucoma and cataracts, cataract surgery, on the website, and so you can actually watch these informational videos. And it is true that a picture is worth 1,000 words. And for people who are interested in this and want to know if they're candidates for either some of these glaucoma treatments or cataract surgery or LASIK, we do screening exams. For LASIK, they don't cost anything. We're happy to screen you and see if it's even worth talking about before you start making any other plans.
So even 30, 40 years ago, what were the options for people, for instance, suffering from cataracts?
30 or 40 years ago, the risk of having cataract surgery was exponentially higher than it is now. And the lens implants were made of polymethyl methacrylate, which was basically plexiglass, the same material that you would make windshields for airplanes out of.
Wow.
And the surgery involved an incision that was 8 to 10 millimeters wide. If you didn't have astigmatism before surgery, you certainly had it after. And 30 to 40 years ago, you would have spent probably a week to 2 weeks in the hospital with sandbags on either side of your head and a bedpan.
Wow.
Today, that surgery is a 10 to 15 minute procedure. If you add the iStent, you're adding 5 to 10 minutes, and you're
That's
coming
amazing.
out of it with correction of astigmatism, and in some cases a multifocal lens, so that you can see far, intermediate, and near without glasses. It's remarkable stuff. It's changed dramatically just since I've started ophthalmology, but I'm not going to tell you exactly how long that's been.
Okay. Let's just say long enough. You know that
long enough.
It's come a ways.
Yeah, that's true. And I will tell you, there are some advantages to being the old lady on the block, as it were. In terms of the volume of experience and understanding the history and the course of the disease, and it's also fun to have patients that I've known for 12 years walk in and still be seeing well.
Okay, Dr. Sharon Richens, thank you so much for stopping by this afternoon. Very exciting stuff.
Thanks for having me.
I look forward to the next time we get to visit. We'll take a quick break. Back after this.